We are learning more about how climate change is impacting human health. According to the Lancet Medical Journal, increasing temperatures are affecting vulnerable populations, including adults over 65 and children under 1. The report says these populations are being exposed to more heat waves now than in decades prior. Heat-related deaths are also up by 68%. Dr. Neelima Tummala writes about this in a Scientific American article titled, "Climate Change is Fueling a Public Health Crisis. Doctors Need to Address This." Doctor, thank you for joining us on this. This is a fascinating subject. You're an ENT surgeon and co-director of the Climate Health Institute at George Washington University. I want to get that out of the way, too. Why are kids more vulnerable to, health issues because of climate change?
Well, Omar, thank you so much for having me. This is an issue that is incredibly important to me. Children are some of our most vulnerable population. They have smaller body size. They are not able to dissipate heat as well as adults are. So they're just more susceptible to these heat extremes. And as you mentioned, the IPCC reports on climate change tell us that with global warming, there will be more heat extremes. So a heat extreme event that previously may have happened once every 50 years, under 2 degrees Celsius of warming is going to happen every 14 times more often. So clearly, children are going to be more susceptible to these heat extremes. They don't dissipate heat as well. They have a higher surface area to body ratio. And a lot of times, kids can't tell you if they're feeling overheated or hot. And so then they're more at higher risk of having heat stroke and heat symptoms.
I'm a dad to a little one. So, when you hear about health news and kids, your ears perk up. So what kind of conditions are you seeing?
So as an ENT surgeon, a lot of what I'm seeing is the respiratory impacts of both heat and air pollution. And so we know that with higher levels of heat, there's increased ground level ozone, which is also known as smog, which can really negatively impact respiratory symptoms in kids, most specifically increasing their risk of asthma attacks. In addition, seasonal allergies are getting worse. And so, environmental allergies are such a huge issue, especially for kids. It increases their nasal congestion. They don't sleep as well. A lot of times they don't do as well in school. And studies have shown us that over the past 30 years, the environmental pollen allergy season is about 3 weeks longer than it used to be. And this is in part due to changes in temperature and precipitation patterns associated with global warming.
Now, according to the Lancet, viruses like dengue and malaria are also spreading more due to climate change. Give us a correlation there.
Right. So again, when we think about what is it that global warming is doing, it's changing temperature and precipitation patterns. It's changing humidity. It's increasing both flooding and drought. So this impacts mosquitoes. And so it therefore impacts the spread of a lot of different viral illnesses such as malaria and dengue. And so basically what we're thinking about here is that the climate sensitivity or the environmental suitability for a lot of these vector-borne diseases is changing. And that's how disease processes like malaria, dengue, West Nile virus, Lyme disease, all of these are being impacted, again, because the environmental suitability for these vectors is changing.
Then where do we go from here? What kind of action would you like to see, not only from the U.S. government, but other countries? Because if this is affecting children and older people all over, it's not just in the U.S., what do you think needs to be done?
Right. So the first thing, like you said, Omar, is we need to take action, right? So, the United States, with the passing of the Inflation Reduction Act, really was able to achieve a lot of where we want to go in terms of decreasing emissions by half by 2030. But we really need to be thinking about frontline communities and communities that are most impacted by global warming and by air pollution. And so definitely would love to see more policy in place that really protects these frontline communities and those who are most impacted and protects our most vulnerable populations, which are children and the elderly. And then on an individual level, we all have our own individual roles to play in terms of impacting climate policy and really, changing the public narrative on climate change. And so the more that we can do and talk about climate change, we can really sort of set the stage for more aggressive action moving forward.
But before I wanted to ask you one more question, but I think we're out of time about climate anxiety, but it is real. So just want to get that
Very
out there.
real.
Dr. Neelima
Yes.
Tummala, thank you very much.
Thank you for having me.